pet parents, and welcome to another episode of Your Natural Dog. Today, our guest is Dr. Katie Kangas, who is one of my absolute favorites. Dr. Katie is one of these really incredible multi-modality practitioners. She does food therapy, she does acupuncture, chiropractic, herbal therapy, but one of the things that she's best known for is her specialization in animal dental health. She is your dog's best dentist. So today we are talking all about dog dental care and why it is actually really important. So we'll talk about preventative care, which is always, the ideal thing, working in a holistic way to make sure that our dog's mouth and the microbiome in the mouth and all the things that it connects to are in good health. But then also look at some acute issues and some of the other ways that we can help our pets and make it a little bit less scary. So please enjoy this conversation and stick around.
I had no idea anything about hemp oil products. There's so many on the market and everybody says, oh, mine's the best. I didn't understand how they work. We really got no information about it in veterinary school. So what I loved about this product line is that I was educated. I got scientific resources. The way that I do my thing is, whatever's the problem, we try. I guess I don't use it by itself, which is actually really nice because I can use the full spectrum hemp products with Chinese medicine. If people's pets are using conventional medicine, I can combine things. I think that it really works to help with quality of life in cancer patients. Certainly my clients have been very happy with their results in their cancer. I've had some Cushing's patients that have great pain relief. A couple of coughing dogs that wake their parents up at 1 o'clock in the morning, and gosh, one little bit of extra tincture in the middle of the night. I always ask myself, is this a case where the full spectrum hemp might be appropriate for the patient? Anxiety, seizures, for sure. I've definitely had some seizure dogs that all they need is a clean diet, no more chemicals, and the full spectrum hemp. So I always ask that, and then I ask more questions about the patient, see how they responded. I definitely have seen some great responses, so I'm always looking at it. Once again, we have zero education. We learn nothing about the endocannabinoid system in veterinary school, so we don't know what's the mechanism, how does everything work. We have misinformation that's been portrayed from the chewable products. Basically, if dogs get into their owner's stash, sometimes those dogs can have issues. Many times the dogs just get a little stoned, but the parents don't understand it, and the veterinarian calls it a toxicity, where it really isn't a toxicity, but it's fear. It's fear and lack of education. And so again, that's where it wasn't until I met Angela and she gave me so many resources that I felt comfortable with it. If you're looking to make things better for your pet, let's go natural. Let's look at quality food. Let's look at quality supplements, the full spectrum hemp oil. But it's all inflammation gone wrong. So what if we beat inflammation early in the game and give these animals quality for as long as possible? So get educated, ask more questions, and see what works for your pet.
And we're back with the beautiful Dr. Katie Kangas. How are you doing today?
I'm wonderful. Thank you so much for having me. It's so great to join you both today.
You too. It's always so much fun to talk to you. I feel like I learn something every single time I talk to you, and which is why Carter was like, hey, we've never talked about teeth and dental disease. And I really want to talk about it because of how hard it is to deal with when you rescue an old dog, with all the problems, or even, as my soul dog Odie, when he, got 16 and a half, it was really hard to get in there and do anything. And I know that I came up with some things that worked for my, in my situation, but I would love to hear people think that the only option is we put them under anesthesia and do the deep clean. I want to talk about some of the holistic alternatives and things that you've used in your practice that you've seen work so well, especially for the old dogs, because I know one of my biggest fears was putting him under to
Yeah.
have his teeth cleaned, and then the recovery and the pain and the all that.
Yeah.
I know that if I had you in my neighborhood, I would have felt a lot more comfortable, but my choices where I lived were slim, and I just didn't
Minimal.
trust anybody. So yeah, let's
Yeah.
talk about that.
Awesome. And I will say that, many people are in the same, same boat where they're fearful of the anesthesia, especially if the pet is older or has, concurrent health problems. And bringing in the conversation about older pets is such a good, uh, you know, uh, framework here, because pets of any age can have dental issues, but obviously older pets are generally going to have more advanced dental issues. And oftentimes they have other things going on that really preclude people from wanting to jump into the anesthesia part. That said, what I will say is I have a very heavily trained background in dentistry, which really puts me into a unique niche, which I love, of understanding so much about dentistry, but also being very rooted in holistic and whole body health. And combining those two, there's very few veterinarians that really have both scopes. And so that is really nice for me to be able to support people really well with all of that background. So that said, what I like everybody to know is that there are definitely situations where putting them under and addressing things can be enormously beneficial for that pet's health. But there are also many things that we can do holistically and naturally to support better dental health, better oral health. And the great thing for everybody to really understand is that our oral health, our pet's oral health, is affecting the rest of our body 24/7. So really, whole body health is very impacted by what's going on with dental disease or oral health. And that is because the blood vessels in the gums and the gingiva are sharing any inflammation or bacterial load, both, sharing it to the bloodstream, and it's going everywhere. And it's not, and most people know, hey, dental disease is linked to heart disease, cardiac issues, kidney, liver. Absolutely, because it's affecting all of the major organs, but it's affecting everything with just inflammation. So they've even shown that anybody who has especially advanced dental disease, that can impact your joints. It can impact arthritis. It can impact potentially, driving even other chronic diseases like cancer or IBD, because it's just, sharing more inflammation with the body. So it is such a good topic to be talking about because it is so impactful. And then to cut to your awesome question, to cut to that point about what can we do naturally, there are numerous things that we can do. And, if people are able to brush their pet's teeth, that's still, kind of one of the gold standards of what we would aim for, what we would goal for, is to brush the teeth with a soft bristled brush. It can be a brush made for pets. It can be a human brush. It doesn't matter as long as it's soft, or even a child's, toothbrush, depending
And
on the
how
size
often
of the
do you
pet.
have to do that for it to be effective?
Great question, Carter. Really, daily is the absolute goal. They've done studies to show that if you don't do it at least every other day, it has minimal impact. So if you're just brushing their teeth once a week or so, I mean, it's still better than nothing, but it's not doing a ton. And the reason for that is the plaque rebuilds up like instantly. I mean, you go for your pet goes for a deep cleaning, we go for a cleaning within 24 hours, you have more plaque on your teeth again. And plaque is that biofilm of bacteria that's just, spreading across the teeth and the gums. And so just the mechanical wiping away of it every day, because the biofilm is very, strong as a group unit, and the actual wiping away with a brush is really impactful compared to a lot of other things that could be done. Now, that said, there's amazing things that can be put on the gums. And a very simple thing is coconut oil, or MCT oil, is
Or full
naturally
spectrum hemp extra.
Woo!
Well, that's why.
MCT.
Yeah, what I love that you're saying that is because so right now I'm in a debacle trying to prove what bioavailability means. you know, I'm thinking bioavailability is common sense. If I put a liquid in my mouth, it's going to be absorbed into my mucous membranes and get right into my bloodstream. And of course, I know all about that because I make a full spectrum hemp extract, and we make it so small so that the moment that it hits, it is being absorbed into the bloodstream. But that means also all of those bad things that you just talked about on the teeth, all the bad bacteria and all that is getting directly into the bloodstream, which is why I think we don't, unless you understand that that's what our mouth is, that's why we hold that tincture under our tongue or we put it right on the gums, is for that reason, is to get the good stuff in, but the bad stuff gets in too.
Yeah.
So I'm glad that you brought that up because I'm like, yep, all makes sense now. All
Yep.
makes
And
sense.
the bioavailability, like you said, you know, with the transmucosal, you know, it's mucosal absorption. It's just going right across those mucosal membranes and then into, you know, the body systemically. But it's wonderful that MCT oil is used as, you know, the carrier oil for your awesome products. And it's also such a good tool for oral health. So, and they've shown in studies, you know, for animals and humans that coconut oil or MCT oil is going to be naturally anti-inflammatory for the gums, and it's naturally antimicrobial.
Yeah.
So it's a win-win, and it tastes good. So
Right.
it's a wonderful thing to use, either just rubbing it on the gums if the pet won't accept a toothbrush, or you can put it on the toothbrush. And of course, CBD and cannabinoids are anti-inflammatory and immune modulatory. So, hey, you know, that's totally great to put on the gums and in the mouth as well. And then I'm also a fan of some essential oil blends. Dr. Melissa Shelton of Animal EO or Animalio, she has a blend called Dog Breath.
Ah,
And yes, and MCT oil is the carrier oil. And then it has 4 essential oils, which include peppermint, myrrh, helichrysum, and copaiba. And those are
I want to
all
brush my teeth with
phenomenal
that.
for oral health. Absolutely. And peppermint obviously freshens the breath, but it's also antimicrobial.
Mm-hmm.
And then copaiba is a powerful anti-inflammatory plant
Yep.
that has outperformed prednisone in studies.
Mm-hmm.
Like, so cool. Myrrh is known to be excellent for oral health. And then helichrysum is a powerful healer of tissues.
Oh,
So,
helichrysum actually has shit, I'm gonna mix it up. Is it CBG or CBN in it?
ooh, yeah, and
Oh,
and as we know, a lot of essential oils derived from plants have certain cannabinoids in them. So, like,
exactly.
you know, what a beautiful, you know, network and synergy of all these things together. And obviously, you used that, you know, brilliance in creating your formulas, and so, you know, we can bring that into the oral health discussion. So,
Yeah, I
yeah,
love that. That to me sounds like the perfect blend for anybody's mouth. And if you do have an old dog or you have a situation in your mouth where something's injured or something's not looking too good, adding that full spectrum and brushing with it is amazing. Like I literally just had something on my where, oh my God, my gum is irritated. What's going on? Blah, blah, blah. And I can put my ease in it and just watch everything heal right up within days.
so.
Or every time I go out of town and I forget toothpaste, I brush my teeth with my ease. And I'm always like, why don't I do this every day?
See,
Everything looks
that's a
so
golden little
happy.
nugget. I'm going to start doing that. I love that. I'm so glad you brought that up. And pets get a lot of, you know, masses, oral masses in the mouth, sometimes little abscesses, things like that. So, I mean, that's a really great tool to be applying onto, and it's so safe to apply that onto anything that looks abnormal in the mouth. It may not totally resolve the problem. It might, but no harm, you know.
Right.
I mean, only positive impact. So go for it. That's
I love
awesome.
it. So
Yeah.
let's talk about like raw, meaty bones, because that's one of my favorite things. This is what always amazed me at my rescue is how different dogs are. Like, you know, how they could be fed the same thing, be kind of the same age, whatever. And this dog's mouth is perfect. And this dog's mouth is covered in, you know, whatever. That never made sense to me. But one of my easiest things to do with my bigger dogs was just to give them, you know, like a turkey, a raw turkey neck or a duck neck or a raw meaty bones. And that seemed to really help. I didn't
Absolutely.
feel like it helped with my little dogs though. I always felt like I still had to go in and
Interesting. It's interesting you added that little comment because I can speak to that too, and I'll back up and speak to the whole, scope there, is that indeed raw meaty bones are an excellent tool to bring in if it works for the dog. Now, caveat here is that not every dog is a suitable match for chew items.
Nope.
Sometimes they will try to swallow them whole, or and you don't want to give your dog a bone and then leave the house and
Right.
not be observing them. And so those are some side notes there, but in general, raw meaty bones are going to be a really wonderful thing for the pet to actively help to clean their own mouth with the chewing. We also know that raw products, raw meat, is going to have natural enzymes. Anything that's been heated or processed doesn't. And these enzymes help protect the gums as well.
Awesome.
Also, anything that's been heated or processed becomes pro-inflammatory, which means that pets that eat processed food, and humans that eat processed foods for the most part, and obviously high sugar foods, that is going to promote more, bad bacteria and periodontal disease and dental disease. And so just by the mere fact of pets eating raw diets, or at least very low processed diets, that's already going to put them in a healthier bracket of, oral health situation. But the raw meaty bones are really helpful as well. And some of the things that are used for that are often the chicken necks and the turkey necks, because they are so safe to chew on. They're not going to damage the teeth. The one, the one caution with raw bones is that anything that's hard enough, like the rule of thumb amongst veterinary dentists is anything that you can't bend a little bit with your own hands or dent with a fingernail is hard enough to potentially break teeth of dogs. Okay. And so if you give them, and especially if it's long and thin, if it's a big knuckle bone, then, it's occupying so much of their mouth when they're kind of chewing on it that they're not coming down with as much force. But if it's a long leg bone or something like that, that's really hard, their jaw has so much force, they come down on the bone. If the bone is as hard or harder than their teeth, the teeth can break. And we see broken teeth all the time. And it's estimated that 1 in 10 dogs have a broken tooth in their mouth, at any given time. So, and that's an issue because those can abscess and obviously they're painful, etc. So we do have cautions with bones, but if the bone has any give, and that's why the necks are so great, because they have these little cartilage, vertebrae in them, they chew up fine. They're not going to damage anything.
Natural floss.
Yeah. And they have enough meat around it in the neck meat that they really need to sink their teeth into it to get into it, which rubs on the gums. Because if it's not really rubbing on the gums, it's not really doing anything, which is why dry food, the whole myth that had been propagated for decades from many veterinarians of, oh, if your pet eats dry food, it's going to help clean their teeth, which is obviously, we know, completely not true. And we know that, first of all, a lot of pets don't even chew their kibble. I mean, if they regurgitate, it's just wet kibble. It looks exactly the same. They just swallowed it. They didn't chew it. And even if they catch a couple with chewing and happen to crunch on it, it's only on the points of the teeth. It's not affecting the gum line. And the gum line is what matters. The points of the teeth is cosmetic only. So if the points of their teeth are a little whiter and a little cleaner, great, that's beautiful, but doesn't mean anything to their health. And so for pet parents, this is a good little nugget too, is when you're looking in your pet's mouth, yes, we're looking at the tartar, the level of, hardened plaque, calcified plaque. But what we really need to be looking at to gauge and judge the dental health of our pets is the gum line. If the gum line is, nice and pink, and obviously not bloody, not dark, not inflamed looking, not swollen looking, then obviously that's a good sign. If the gums are swollen, purple, dark pink, dark red, or just look angry and, delicate or whatever, then that's a problem. And the interesting thing is pets can have very heavy levels of tartar, but the gums actually aren't so bad.
Yeah.
And then on the flip side, they can have not so much tartar, and the gums look awful. And so it can fool, the level of tartar can fool people. And honestly, even veterinarians who aren't as deeply trained in dentistry, as I, and, obviously dental specialists, some veterinarians don't even know that. They don't catch that. And they literally, in the record, they gauge dental disease by the level of tartar, 4+ tartar, 2+ tartar. I'm like, that is not an accurate gauge of what's going on. So they really need to be documenting, what do the gums look like? Now that said, if you put a probe down in there, you can find stuff that isn't as obvious. That's one of the arguments for doing an anesthetic dentistry, is you can really find stuff under the gum line with probing and x-rays. But still, in a physical exam or a pet parent evaluating their pet and just looking in there, it's nice to be aware of, it's actually the health of the gums that's our best indicator of what's going on. And if the gums bleed easily, that's the first sign of gingivitis. So
this reminds me of something that you said when you were on a panel that I was hosting at the Feed Real Summit this past year, and there was a question from the audience about what is the value of a non-anesthetic dental. And I think you were kind of like, well, you're mostly just doing an aesthetic cleaning of the tartar, right? You can't get into the actual root of it, to the gums.
Yes, and thank you for bringing that up, Carter, because that's such a good thing for pet parents to understand, is because and understandably so many pet parents are going to be, gravitate towards the non-anesthetic cleanings. Obviously, that sounds like a way better, thing to be doing. The problem is most people don't understand the significant limitations of that as a health value to the pet. So, as you just said, it's really more of a cosmetic value. And the reason for that is it's, as we just said, the gum line and under the gum line are the parts of the mouth that are affecting the health, especially the systemic health, but even the mouth itself. And so when a non-anesthetic cleaning is happening, they're only able to scrape, which we call scaling the teeth. So scraping the plaque and tartar off the teeth, and then polishing it to smooth it out so that, the more tartar doesn't glom on there again right away. So they scale and polish the teeth, but they're not in an awake pet unless the pet is extremely tolerant, which is not typical. And you have a very skilled hygienist, which is also, questionable for the level of training that a lot of non-anesthetic dental, tech personnel are. Then you're just cleaning the teeth and they look prettier. But under the gum line, there's disease lurking that nobody knows about. And it actually it can almost give a false sense of security, because then you're like, oh, my pet's teeth are really clean, and people don't know that they're still loaded with disease. And I personally, in my holistic practice, have seen pets come to me. We'll go back to Angela's awesome comment on the small dogs, because especially small dogs, I was going to interject here that a lot of, especially small dogs, will come to me that have had regular monthly non-anesthetic cleanings. The crowns of the teeth, the part of the teeth we can see, pearly white, look beautiful. You would think, and other veterinarians got fooled. They would open the mouth, lift up the lip. They're like, oh, the teeth look clean. There must not be. But I'm looking differently, and I see the gums completely receded. You can see the roots exposed in multiple teeth in their mouths. And the gums are angry, purple, dark red, really, really, inflamed. And I look and I'm like, oh my God, this pet has terrible periodontal disease, but the teeth are perfectly clean. And literally I touch the teeth and they're mobile, they're moving. They're totally like infected and ready to come out. So that's the rub with, and so what I tell people is, if your dog is super tolerant and you have a dental hygienist person that is very good, you may be getting some value out of that. But in the majority of circumstances, especially if the periodontal disease is pretty advanced, you're not getting enough value out of that to really, make it worth it.
So at my groom shop, that I don't have anymore, we would get 70 to 100 dogs on a Friday and on a Saturday. And that's where I learned that, 80% of dogs were suffering from something. And I was flabbergasted at not only that the not brushing or whatever, not even the looking into your dog's mouth, much less giving them anything in their mouth. These little dogs had hair, so much hair wrapped up on their gum line. I can't tell you how many times I would take out chunks of rotting, disgusting hair with the tooth wrapped in it. It's really unbelievable how these little dogs suffer, and I can't even believe they eat. That was probably the number one thing I learned, is people would go, my old little dog, he's not eating anymore, and he loves to eat. And I'd be like, let me look at this. And I'm like, he's in pain.
Yeah, it
He's
is
got tooth
painful.
pain. He's not
Yep,
eating because he can't chew that anymore. And I'm
yep,
like,
yep.
watch what happens when I give him this soft food, and he inhaled it because he was so hungry. And it made me so sad that we don't see it, so they don't think about it. But you got to look in there. Everything that they eat off the ground, sticks getting stuck in there, all
Yep.
that stuff.
I love that you brought that up because veterinary dental specialists say all the time that many pets live with horrible dental disease, which is painful and, brings infection in the body and all the stuff we talked about, but because it's a hidden source of infection or inflammation. So I love that you said, look in there, get in there. Why is my pet not eating? Or why does the breath smell so bad? Or, all these various things. And to just tag on to some of your great comments is that indeed small dogs in general will get more advanced periodontal disease earlier in life than large dogs. It's a genetic thing, but it's also an anatomical thing. The anatomy of their face, especially if they're short face breeds like the brachiocephalics, the bulldogs and et cetera, Shih Tzus and pugs and all these cute kiddos that have no face. Their teeth they have the same number of teeth as a dog with a big old long nose, like a big shepherd or a lab, and they're all crunched in there, so they're all crowded and stuff sticks in there. Not only plaque, but as you said, hair and every other little thing that goes in their mouth. We know everything goes in their mouth. And the other interesting thing you said about the hair is so many dogs, a whole nother podcast topic, so many dogs have allergies and itchy skin. And what do? They bite, and with their teeth to scratch themselves. And tons of dogs with allergies have hair corroded in their teeth and often will literally get worn teeth because over time, hair is abrasive, the keratin in the hair and stuff. And the teeth will literally wear down to like nubs on the front, these incisors.
Mm-hmm.
And that can be from chewing things, but often it's from chewing themselves
Right.
that over time creates that. So some interesting little side notes and the great stuff you brought up.
All right. So, I was in San Diego where you are, which I'm in love with San Diego. I have a question for you. So I'm fascinated. I was up in the mountains in Fallbrook, which I was in love with. And I'm fascinated by the packs of coyotes just running around, just existing. And I'm like, they're dogs. They're running around dogs. It blows my mind. I love it. I think it's the coolest thing. What would we find if we looked into one of their mouths?
That is a very good question. And I don't know that I can answer that totally accurately,
What do you
but
think?
from
What do you
what
think
I've
you'd find?
right, from what I've read, here and there and heard here and there, um, and I don't know that I've seen any actual specific studies that, that I've looked at on it, but you would absolutely expect that they would have healthier mouths than the average pet. And that for several reasons. Obviously, they're eating a species appropriate diet. They're eating the wild diet that their bodies were
I
designed
asked
to
them. I
eat.
yelled out. I
And
said, "How are
so,
you nutritionally
yeah,
balancing your meals?" They didn't give me an answer.
A
that's a
lot of
great
synthetic
question.
vitamins, I'm sure.
Exactly. Yeah. So, I mean, they're eating what they're supposed to eat. And, they're also eating a variety of, what they can. So they're certainly not eating processed food. They're not eating things that drive inflammation. And, process and a lot and beyond process, because process alone has its issues. But most pet foods on the market are very non-species appropriate ingredients, meaning they're loaded with carbohydrates, which break down to sugars and bring more sugars into the mouth, which drive more bacteria. Obviously, wild canines are not going to be faced with that issue. Thank goodness. So the biggest issue that they might have, I mean, obviously with age, they might get worn teeth from, whatever wild behaviors that they need to do to survive. And they may get broken teeth, and, they might have to live with that, here and there. But by and large, they're going to have way less issues and way less inflammation impacting their systemic whole body health. So, obviously, I think as much as we can do to support our pets to have the most indigenous species appropriate lifestyle and diet, the healthier, support that they're getting for so many things in the body. So, yeah.
I agree.
Yep. Yeah. And I will add in one more mention. There's a product, especially Angela, when you talked about older dogs and or pets who have concurrent heart disease or other issues, and people, and pet parents are, extra concerned about putting them under anesthesia for a full dentistry. And even if you're just being proactive, you don't have to have that situation. I will mention a product, and I do have it sitting next to me just to show a little demo. But the TEEF product. And this product is unique, and it's a water additive. And we were just talking about how a lot of pet foods have carbs and sugars in them. And the great thing about this water additive, which comes as a powder, and it comes with a tiny little scooper, and you just put it in your pet's drinking dish every day. And it's for dogs and cats. And it's a unique prebiotic mix. It's called TEEF. And so TEEF. Pretty cute name, like a little child saying teeth. And so you put this in the drinking water, and it has prebiotic ingredients that are supporting good, healthy bacteria in the mouth that we want working for us in our favor to make our mouth healthier. But meanwhile, they're also decreasing the bad bacteria that are causing the periodontal disease and the dental disease and the bad breath and all of that kind of stuff. And so especially if the pet is eating, or the human, because they have a human version as well, especially if you're eating things with carbs and sugars, because these prebiotic ingredients are competing with the carbs and sugars, and the bad bacteria go attached to that, and they can't use it for food, so they starve and die off, which is such a beautiful thing. So we're getting rid of the bad bacteria without antibiotics, without killing off any good guys. In fact, that formula is actually supporting the good guys, suppressing the bad guys. And the beautiful thing about that also is that it's working below the gum line where your brush can't get. So again, if we're brushing, we're doing great. That's helpful. We're removing plaque. We're getting at least the gum line, but we're not getting under the gum line, without probing and scaling and all that stuff. Well, when they're drinking the TEEF water, those prebiotics that are, totally absorbed into the water are getting up under the gum line and pulling bad bacteria out there too. So it's even a little more far reaching or proactive than brushing. It's awesome as an adjunct to brushing, but if you can't brush, whoo, this stuff is the bomb. I mean, it really works. And a lot of pets that especially older dogs, or, dogs that, people can't get their teeth cleaned, they come back after they've been doing this for even 1 week, 2 weeks, and they're like, their breath is remarkably better. They can kiss, I can, have them lick my face again, and I couldn't even barely be in the same room without gagging before. Like, it's really cool. And when the breath gets better, the bacterial population has changed, because the bad breath are odors that are released by yucky bacteria. So cool product and natural.
Very cool product. I use it, and I would love to talk about how I use it. But also keep in mind the same thing with our mushrooms and our mushroom liquid tinctures. They are also antibiotic. Most antibiotics are made from mushrooms. Antifungal, anti-inflammatory, kind of do the same thing as TEEF does, meaning feed the prebiotics. So TEEF.
Yes.
Yeah, like feeding the good stuff, the good bacteria.
Yeah, love mushrooms for many reasons, but I always share with people they have prebiotics in them too.
Right.
And mushrooms are a powerful natural tool that I love to bring into. I mean, every patient that I see, I'm always recommending mushrooms, because
good. We're going to talk about that. I want to talk about that.
Okay,
but
awesome.
For TEEF, when I put TEEF, I had a multi-dog household, lots of dogs. When I put the TEEF in the water, my dogs wouldn't drink it because I had to put more because it was multi. But what I did instead, and what I often did, because I had so many old geriatric dogs with whacked mouths, is I always had it in a spray bottle so that I could spray it in the mouth if they weren't going to drink it.
Ingenious.
I also love using silver hydrosol as another tool to kind of help, support the mouth.
You got it. Another good one.
And the mushroom. Yep. So it's like there are, if you got that old dog with that jacked mouth, there's lots of things you can do to help support them.
Thank you for bringing that up. That is a really wonderful way to apply it into the mouth, is just spritz it in there. I have clients that syringe it, into the mouth if their pets won't drink it. And then another little nugget of, possibility for people is you can mix it in diluted broth or bone broth,
Oh,
or
good.
even diluted raw milk, goat milk. But it would need to be about 3/4 water, about 75% water, and about 25% broth or, whatever liquid. And then most pets will drink it.
Right.
And what you would want to do in that circumstance then is, if you can, a couple times a day would be nice. Even if it's just once a day, it's still beneficial. But a couple times a day in between meals, just give them like an ounce or two of diluted broth and just let them lap it all up. Because the thing with TEEF is that if you put it in food, there's enough natural sugars and other components in the food that the bacteria still have stuff to latch onto. But if it's going into the mouth when there's not a whole lot of other calories coming in, then all the bad bacteria are like, woo, look at that, we're going to that. Ding, got them,
Ah, that makes
So
sense.
that's why it's nice to give it between meals, but that's also why spraying it on there when they're not eating is another really great method of getting it in.
Yeah,
So
love it.
wonderful.
Katie, I've got a question for you. I recently got a water pick, like a water flosser for myself, and I love it. It has made my flossing game so much easier. Have you ever heard of people using a water pick on their dogs?
I have, and and not a ton, but I love that you brought that up because
We did it
people
at the shop.
swear by those.
We did it at
Yes.
the shop.
And I've had clients tell me that they use that on their pets. So it absolutely can be done. I have clients who use and my dog, she just gets a regular, toothbrush, bamboo handle toothbrush.
Nice.
Yeah, but I have clients that even do the electric toothbrushes with their pets. So I mean, some pets are super tolerant and may, accept a water pick as well, but it absolutely makes sense that that would be an asset as long as they allow. So
Cool.
I
yeah.
love it.
Yeah, great
Okay,
discussions.
so I know we're running out of time, so I just want to ask, I know that you are having so much success using Myco Dog and CBD Dog Health in your practice, which we just love and appreciate. Thank you so much for trusting us and using our amazing products and getting such great
Absolutely.
results.
Are you kidding? I'm like saying thank you for creating products that I can feel great about dispensing to my patients and having available because, it's just such a niche of things that we need. And now I know I have trustworthy, reliable, well formulated, super high quality, and I see results with them. So thank you.
I thank you. And I love that
Mhm.
I found that there was something missing in the marketplace and I knew I could create something better and I did. And it means the world to me to have someone like you see that, recognize it, and then put it into practice. And then watch how we're helping these dogs heal naturally. That's
Right.
literally what we're
And
helping.
that's the best endpoint ever, right? I
We're
mean,
just
that's what
helping the
it's all about.
body's, yeah, we're just helping the body's innate ability to take care of itself and heal itself and not take away from that. So thank you so much for
Singing
being,
my mantra. I love
yeah,
that.
same.
Supporting the body to have its innate brilliance and intelligence and capability in healing itself, balancing ourselves. And these types of products are exactly what we need to help support that.
And the body knows
So,
what to do with it. Body knows what to
exactly.
do it when you give it to it. It goes,
Yep.
oh,
Yep.
yes, thank you.
And both CBD or cannabinoids and mushrooms are both so incredibly versatile as tools to support the body is another exciting thing about both of those, factors is that, and that's what I love to explain to my clients too, is that CBD or cannabis as a plant medicine has so many things to offer to the body. And then, and as you said, the body knows what to do with it. But so many categories of anti-inflammatory, analgesic for pain, calming for mood support, adaptogenic to support, balance in the body in so many ways, neuromodulatory, seizures and tremors and, I mean, on and on and on, anti-cancer. I mean, there's so many things. It's like, how many natural tools, even wonderful natural tools, can check all those boxes? Like, that's a lot of, really good stuff to offer. And then mushrooms, again, superfood. I was on with Rodney Habib recently, and I'm like, mushrooms should wear a cape. They're like, superfood.
I agree.
I mean,
Do
there's
you see they
much
finally
about
got their
mushrooms.
own? They finally got their own category.
They do. I don't know that I know that.
So we
What
have
category?
flora, which are plants,
Yes.
fauna, which are animals, and now we have funga, which are for our mushrooms,
Funga.
because they're
Absolutely.
completely different
Because it's
than either one.
completely different. Yep. And again, so many versatile things, from immune modulatory, gut health, anti-cancer, the prebiotics, on and on and on. I mean,
What
there's
it does
just
for our
so many.
brain. What
Yes.
like lines
Neuroprotective.
make
Right. And then,
cordyceps
yeah,
and
and
reishi does.
cardiovascular and anti-aging. And I mean, again, there's just a plethora of benefits. So how can you not get excited about that?
I
And
know,
then,
I know you agree with this, that
yeah,
Mother Nature provides us with all the food and medicine that we need.
absolutely. Yep.
Cool.
Absolutely. So, yep. It's just having good resources like you that create these products that are user friendly, that we can get at our fingertips, that makes such a difference. So thank
Thank
you.
you, Katie. Thanks.
Mhm.
Carter, you got any fun questions for her? Did you come up with some rapid fire
I've
for
got
her?
some. Yeah, I've got a few just rapid fire questions. They're like a quick yes or no, if you will play, Katie.
Absolutely.
Okay, all
I'm
right.
game.
All right, here we go. We need some like game show music. All right.
Dun, 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 dun.
Big dog or small dog?
Big dog.
Yeah. Morning walks or evening strolls?
Well, morning walks.
Nice. How about wine or weed?
Both.
Wine, I guess, both.
All right, that's all I got.
That's
That's how the day
Can I
was.
just do both for everything? I know those are so good because they're
I
all
know,
good.
tough choices.
Exactly. Depends on what the day was or what time of the day. I love that.
Katie, thank you so much. We always love having you on. You're such a wealth of information, and I love how you just tell it how it is. To me, when I watch those coyotes running around, I'm like, why are we making it so complicated? We really have made it complicated. We really just need to take care of these beautiful animals and give them what they need and let their bodies do the rest. So I
Yep.
love being able to talk to you like that.
Thank you.
And share that. Thank you so much for
And
coming on.
thank you. It's my pleasure, and I really appreciate the opportunity always to, connect with such wonderful people in this, forum. So thank you so much for having me.
You bet. And we look forward to seeing you at the Feed Reel in October.
Yay!
Yeah.
Me too.
Awesome.
Thanks, Katie.
Thank you.
Hello, my name is Jan, and my dogs are Cooper and Chewy. Cooper is a 1.5-year-old pit bull mix who suffers from general anxiety and fearfulness. Chewy is a 1.5-year-old Labradoodle who suffers from separation anxiety. We have done lots of training and exposure to help build confidence and reduce the anxiety, which have helped, but overall, I could still tell that they were very wary and unsure of new surroundings and environments. We have also tried calm chews, and mostly they just made my dogs very sleepy, which wasn't my primary goal because I wanted to be able to take my dogs places with me. When I first heard about hemp oil, I decided to do a deep dive. I am very conscientious of everything I give my dogs and what I put in their bodies, from their food to their treats to any and all supplements. I decided to give hemp oil a try after months of research and learning that hemp oil has numerous benefits, not only on anxiety, but overall health and wellness. The first time I gave my dogs hemp oil, I saw the changes within minutes. They were immediately less overstimulated and more comfortable, not drowsy or sleepy, but comfortable. I am so grateful and excited to have found this hemp oil and know that I am giving my dogs something that is 100% natural and has virtually no side effects. I can't wait to create more experiences and make new memories with my dogs, knowing that they will be able to stay calm and enjoy every single moment of it.